I'm going to talk about this toolkit that we created as part of our work through a coalition that is part of the Immigration Partnership Winnipeg. And I'll talk about refugee claimants in Manitoba, but we do not claim the first #1 spot in hosting refugee claimants. I think folks in Quebec here have done a great job at responding to the needs of the influx of refugee claimants who are running away from the monster on the south of us. So at the beginning of 2017, when the Trump administration came into power, there was lots of rhetoric from Trump's campaigning, and as soon as, after January, we started to see a huge influx of refugee claimants coming through the south of the border. Traditionally, Manitoba and Winnipeg, we've received refugee claimants, but we averaged about 100, maximum 100, between 60 and 100. So within a month, we received 200. So this is quite overwhelming for us. So in February of that year, we got together as a group. And we got together as a group, invited as through our work at the Immigration Partnership, invited diverse stakeholders, invited folks from the Federal Department of CBSA. We invited IRCC, folks who work on refugee claimant issues. We invited folks from the province, the city, the fire department, the police, businesses, settlement service providers, as well as communities that were receiving refugee claimants themselves, Somalis, Djiboutians, Ghanaians, and we talked about how do we respond to this, because we've seen 200 people in 1 month. Probably we're going to see 1,000 people in the next month. And as you know, Manitoba, we say friendly Manitoba, but 1,000 is such a big number. So we got together, and after the meeting, we put ourselves together in a number of different committees looking at the needs of the refugee claimants. We had a housing group that just looked at the housing needs because we were not prepared for housing. We looked at a group that looked at system navigation through registration to welfare and all this stuff. So while we're doing this, there was a lot of negative vibe that was coming from the community members, people in the south, in the south of the province, at the border, small towns that were seeing the brunt of, people who are sleeping at night, and then people are knocking on their door at night because they were cold, or people seeing people walking in their compound at night. This was quite frightening for many people who had never realized this. And then CBC Manitoba hosted a debate one evening, and the debate was very racist title, saying, shall we close the border? No, shall we shut down our border? Like a public broadcaster where we pay our taxes doing this. So we had to fight CBC to change its title. And then there was the local member of parliament for Steinbach, South Manitoba, Ted Falk, who was saying, the folks who are coming through the border are not actually refugees. If you see these folks, they're dressed in suits and all this kind of thing. I was like, stupid. If Canada was on fire, God forbid, Ted Falk is going to dress in shabby clothes and walk across the border? So we got together as a group and decided, let's come up with something to address this issue, of people who are scared of refugee claimant issues. And so we came up with the idea of the Bread and Borders document. And some of the things that we were addressing were common myths amongst the community, the ones that were being perpetuated by people like Ted Falk and many of the other community leaders who are very negative. For example, refugees are weakening Canadian identity, or refugees who cross the border are breaking the Canadian law. They are a threat to our security because these guys are dressed in suits and nicely dressed, so they are not actually refugees. They are an economic burden. They are queue jumpers because genuine refugees come through a queue. Through refugee comes through the United Nations High Commissioner for Refugees, just like the Ontario Social Housing Minister was saying the other day. Canada is being overwhelmed by refugees. The United States is a safe country is another thing that we addressed. And the other thing, we should help those who live here in Canada instead of helping refugee claimants, are some of the things that we came to address this document with. So we created the document, which has a number of ideas, which I'm going to share shortly. But we worked on it to address a number of all these myths. So to look at whether it was going to work, because we had this coalition called Refugee Public Awareness Coalition, because at the time, we were chilling from the previous government's relationship with advocacy issues, and we didn't want our lip to suffer, so we created this coalition. We looked at ways of testing the document. We brought it to a Building Bridges conference of Indigenous people and newcomers that the university hosted. We hosted public events in communities. We tested with workplaces in the community. And meetings, schools that we brought to. We brought to Gretna, which through our meeting with the stakeholders, the province had created a reception center, and the community was very chilly and scared of these refugees. So we brought people together, and it was very interesting. People were quite interested. We tested with friends, family, and as well as government institutions. So we created this document in the end, which has a number of sections, and it's available on our website. If you look at ipwinnipeg.org/reports, you will get it. It has several sections. It's very user-friendly. You can use it, turn it. It starts with introduction, tells you how you begin, conversation process for new friends, people who you don't know but are interested to talk about, because one of the things that we wanted was people to be able to use it around their kitchen tables, invite friends, your neighbors who are scared and wondering, is this a threat to us? Having a discussion, if even old friends that you never connected with, but you want to talk to them about refugee claimant issues and how we should be humanitarian. There's a process for unpacking the myths. It also has a process for myths, one myth per page, and then there's a refugee quiz, which needs constant updating because the refugee numbers constantly change. And then we also have a PowerPoint that if people requested, we could share, which we use for presenting the refugee quiz, which is very important because it's very interactive. And then we have engagement process for medium to large groups. Where do you there's an activity called Where Do You Stand? Has 4 corners. For small groups, questions and answers, and then with signs for visually, people who have hearing, disabilities, and even without talking, that we can use with groups. Common myths and misconceptions about refugee claimants. Then we talk about talking about refugees and migrants, a glossary of key terms that we use. And then where do we get our sources? And then if you wanted to start conversation on refugee claimants, what are the tips that you use to actually get there? Because sometimes even getting there is quite difficult. And then there's an agreement, bread and borders agreement on one page, and then ways to action. One of the things that ways to action that we did is we worked with a local amnesty group, who gave us documents. My doors are open. Things that you hang on your door, small pamphlets that you can give to community members and that kind of stuff. The next step was to find people who could deliver this message. So with the help of United Way Winnipeg, we created a speakers bureau, brought together people who had refugee backgrounds themselves, who can link their backgrounds to the stories of refugee claimants, and trained, with the United Way, provided training for these people, and then helped deliver the material because it was quite overwhelming. Today we'll be called to, our work as the LIP is Winnipeg, but then the refugee claimants come through the south. So small towns like Altona and Morden and Gretna and Emerson were calling us to, and churches were calling us to see what can we do. One day I was called by the Western School Division in Morden, and they said, tomorrow we have an event and this topic has come up. Can you send? I was traveling, so one of these speakers bureau members had to go, and a few others stepped up, and 3 of them had to go and do a presentation. So it was very good to have this speakers bureau because we had a variety of people with different experiences who could share their own stories, human stories to people. Some of the key factors in developing this were we proposed, the document, debated as a coalition, developed a draft, and then to make sure that we had a document that responded to the needs, to test it with people who had the experience themselves, as well as community members, evaluating again and seeing revision, refining it, and then having complete documents. The good thing is that it had overwhelming grassroots support. It has some experiential and technical, people who have experiential and technical knowledge in terms of addressing these issues. Because if you don't have the technical knowledge of refugee issues, it's often difficult to present this material. The key factors in the design, when we do, because we need to address the issue of where we are situated as a community, we start with 3D acknowledgement that even though, as many Canadians, we are saying, let them not come to our country and all these kind of things. There are people who lived in this country longer than everybody, and that we are grateful for all that. And then the document has basis on, adult education principles, some conflict resolution, and then it has meaningful ways, avenues for action through this My Door is Open for Refugees pamphlet by Amnesty International. And then it's very user-friendly. It can be used with different audiences. The different activities have different times. You can have for 2 hours, 4 hours, an hour, whichever you like to use. And then because of our Speakers Bureau, different facilitators, you can use it for different settings, indoor, outdoor, all that kind of stuff. So far, it's been widely accessed. So these are just a few of the people who have used. The last group that asked us last month was staff from Public Safety Canada and Canada Border Service Agency, as well as Public Health Agency of Canada, Regina and Winnipeg staff. Who got together and we did a training for 2 hours for a shorter document, and many of the other community members are responding to it. So that's all that I wanted to share. If people want to use it, you can approach me later or look at the document itself. It's available on our website. Thank you.